Welcome back. My name is Dr. Carl Baird, and today I'll be discussing one of the most commonly overlooked causes of chronic joint pain in adults as they get older. What I'm referring to is ankle mobility, or more specifically, a lack of ankle mobility. So stiff and tight ankles that don't have full range of motion. This can lead to a couple problems. It can lead to more impact on your joints, both directly by not allowing your body to absorb a lot of those ground reactive forces with each step, or indirectly by causing movement compensations. When we can't get that movement in our ankles, our body compensates, and that puts more stress on things like your knees and your joints. And so what I'm going to do in today's video is give you one of my favorite exercises to improve ankle mobility, to take pressure off of your joints and help solve chronic joint pain. Let's go ahead and get started. The exercise is called an eccentric ankle mobilization, and what it's going to do is use an eccentric contraction of our muscle to help get more range of motion in your ankle joint. So to perform, all we're going to need is a step of some sort. So I'm going to use this yoga block here, and placing it close to a wall or something that you can hold on to is good, mainly for balance reasons. So we're just going to start by setting it up on the ground, and to get into the right position, we're going to step onto the step, making sure that our heel is off the step, but the entire ball of our foot is on the step. From there, you're going to step up and press up with your toe as high as you can with that toe. And from there, you're going to slowly lower your heel down. And as your heel starts to go below that step, you're going to slowly bend your knee. And this is the key thing here, is that you don't want to keep a straight knee and just lower your heel down like that. As your heel lowers, you're going to bend that knee. That's going to give you a little more ankle range of motion, allow you to put a little more load into that movement to get a little bit of extra range of motion. And once you've reached the bottom, you can hold it for a second. I feel it right in the front of my ankle, which is where I want to feel it. And then you're going to press back up and do it again. So again, I'm slowly lowering down. As my heel gets lower than the step, I'm going to slowly bend my knee to get that extra ankle dorsiflexion. Really feel it in the front of my ankle. Holding it for a second or two at the bottom, trying to get that extra range of motion, and then come back to the top. And repeat. And there you have it. That is one of my favorite and most effective ways to improve ankle mobilization, to take pressure off of joints and help treat chronic joint pain, even not only in the ankle, but in the knees, the hips, and the low back. It's really important that we have adequate ankle range of motion, and this eccentric ankle mobilization exercise is one of the best ways to get that range of motion back. That's all I got for you. If you have any questions, leave them in the comments below. Thank you so much for watching. Hey, it's Dr. Baird here. Don't forget to subscribe to our YouTube page to catch all our videos designed to help you build the strength and confidence to live active, healthy, and happy lives. You won't find it anywhere else.